Bees Embroidery is celebrating 25 years of providing quality service for all custom garment printing and embroidery needs for Southern Nevada. We use only the best names like Port Authority, Haynes, and Gildan. We're open Tuesday through Friday 9 to 5. For a honey of a job, call us for an appointment at 775-727-9444 or find us on the web at beesembroidery.net or email us at bsembroidery@yahoo.com.
Hi, I'm attorney Jonathan Nelson with J.K. Nelson Law. I wanted to thank everyone that voted for the Best of Pahrump Awards for voting us Best Attorney of the Year. We've been an active part of the Pahrump community for many years, and we always work hard to earn your trust. So if you find yourself in need of a lawyer, put your trust in J.K. Nelson Law and call us for a free consultation. We can be reached at 775-727-9900. Again, that's 775-727-9900.
People with disabilities need their space.
Sorry, I'll be quick.
A workplace within reach. And help only when it's asked for.
Here, let me.
I'm all set. Thank you. After all, everyone should receive the same respect and consideration. Brought to you by the United Spinal Association. Download our disability etiquette booklet at unitedspinal.org.
Boy, that looks expensive. Not my problem. Hi, George, Foreman and family here. We got tired of getting sucker punched with expensive home system and appliance repair fees for about $1 a day.
We have Choice Home Warranty.
They cover over 25 major systems and appliances, including heating, AC, plumbing, kitchen, and laundry.
And if they can't fix it, they'll replace it. Never pay for covered home repairs again.
Call 800-493-8274.
Hey, you.
Me?
Yes, you. Do you want the fastest internet in Pahrump?
Yes.
Valley Communications has the fastest internet for streaming video.
But can I binge watch my favorite programs?
Yes, of course. It's perfect for binge watching, and you can stream as much as you want. No overages, no data limits, and no buffering with Valley Communications internet.
I'll sign up today. But how?
Visit valleycom.com or call 775-727-5312. Don't wait. Get the fastest internet in Pahrump and binge away.
My part-time service in the Army National Guard allows me to keep my community and those I care about safe from threats. Learn more about how you too can live and serve part-time close to home by visiting nationalguard.com.
Everyone knows that landscaping in the desert can be a challenge. Land Art Landscaping is a licensed landscape contracting company that can design and install your own beautiful desert or even tropical oasis right here in Pahrump. Also, weeds can overcome your lot in no time. Land Art Landscaping can clean up the weeds and put you on a monthly service program to keep your yard maintained. Commercial and residential, call Land Art 727-8512. That's Land Art at 727-8512.
What's my passion? The sound of the ukulele, the softness. It goes right to your heart.
Stay engaged and keep doing what you love. Hear well, stay vital. Check your hearing wellness every year.
Now is the time. Get off your seat and into the beat of fitness for just $10. We offer everything you need at our hometown gym, and most plans are just $10 a month. Plus, there are no long-term commitments required. We have tons of options: yoga, high and low impact cardio classes, circuit training, and new innovative classes to keep you motivated. With 15,000 square feet of fitness, we are the largest full-service gym in Pahrump. Get started today. Come and see us at Fitness 410.
We've been fighting the war on drugs for a long time. We answer the phone 24/7, 365 days a year. On a busy night, we answer hundreds of calls. This war on drugs needs our intervention.
Since 2014, Addiction Hope and Helpline has helped people struggling with drugs and alcohol.
When the phone rings, we help people when they need it the most. When we get a caller into treatment, it feels right. It feels good. It's a blessing.
If you're struggling, drinking, using, and need to get clean, don't suffer alone in silence. Call Addiction Hope and Helpline.
Our people understand, and many are also in recovery. Call for support and strength. You can call for someone who can't or isn't willing. It's an act of love. Together we can help you beat this thing and erase addiction from your vocabulary once and for all.
Call 800-773-0131. 800-773-0131.
I just got a new air conditioner. Top of the line.
I bet mine's better. It's so efficient and quiet, I hardly know it's running.
I've got you both trumped. I've got a Linux.
So do I.
John Air carries Linux products to meet any budget. Don't gamble with your energy dollars. Call John Air.
Lennox. Innovation never felt
We got a little different setup. I look a little smaller on the screen, but that's just got a little wider view on that. 727-8750 will be the call-in line for those people who dare to put their voice on the airs. There are some people that are really, really good at it, like Ray and a few other people, but you're free to call in. Any rate, summertime, right? The heat, we've got that brewing. Hopefully we're going to get a break on that. The days start getting, well, they get shorter by a minute per day. We've hopefully passed the hottest part of the summer, but I've been watching the weather down south. It's been horrible down in Texas. They've been 110, even worse than we are right here. So that's kind of, let's see, I think we have Ray. Ray, are you there? Let's see. Ray?
Yeah, can you hear me okay?
Well, I can hear you through the thing, but they didn't hook up the speakers, so go ahead.
All right. It's good to see you live on TV. Been there like this is the second or third week in a row, and I'm proud of you, Doc.
Trying.
All right. All right, I got...
Oh, okay. Okay, so we're having some technical difficulties with that. So are we going to get the speakers back up? Yeah. Okay. So I guess Ray will call back or hang on the line. So Ray, if you're listening, I guess you got to call back until he gets the sound set up right. In the meantime, we'll just hang out for a minute till hopefully he gets that up. But anyway, yeah, we've been trying to make the show. I haven't been traveling for a while, and of course we've been in the office. So Ray, I guess if you want to call back, try back now, because I guess he's got the sound system, hopefully.
Ray?
I don't know that I can hear it back here in the TV studio.
Okay, I'm here. Ray the flag, man.
Yeah, we're kind of...
Ray the flag, man. I can hear you, Doc.
Yeah, well, I can't hear... I can hear him in the production room, but I can't hear him because you don't... I don't know what the speakers are doing. Ray?
All right. Well, let me comment on a few things.
Okay, go ahead.
They said that in Los Angeles, there were so many rats, there may be the bubonic plague. And some of these rats may be transported, you know, like on different produce trucks and stuff like that. If they were to come into, like, Pahrump or Knight County, could we get the plague out here? It's the flea of the rat, I believe. It's not like, I don't think it could be spread between people. Can the plague be spread from person to person, or you need the rats and the fleas? What is that?
Well, they have to bite, so, but it's tularemia and some other diseases that they spread, but it's easily treated with tetracycline. They just didn't have tetracycline back in the Dark Ages, so that's why everybody died from it. It's a very treatable disease. The problem is identifying who has it. And in those homeless populations where they get bit by rats that carry that, and then the uninfected rats can spread it from biting different people. It's not something that I've studied on the bubonic plague, but I think I would be more concerned about tuberculosis in that population, which can easily be spread here. And that is a devastating disease, especially in elderly people, because you can't really take the treatment, which is INH and rifampin, over age 35 or 40. They really frown on it because it's very hard on the liver. So the plague, while it was back in the Dark Ages, people were spreading it kind of, and I think the numerous rats, and so these people live in these environments where they're basically, they're closed in, they're not getting care, so you wouldn't know that they have it until they've spread to other people. And the chronic coughs, if they're smoking, tuberculosis, that's what I worry about. And then I worry about all the other diseases that are associated with it. We've got immigrants coming in bringing measles. We've got diphtheria that's coming in. So there's a ton of illnesses out there that can be I don't think there'll be a pandemic. I don't think it'll get that bad. But I don't know why they even blew the thing out of New York with the measles out of proportion. Yeah, I mean, we grew up with measles, and some people got orchitis, testicular infections and other things of that nature, but I never remember ever hearing of someone dying of measles. I guess it's possible if you're very sick and you get it, but I don't know what the issue is with that. So I don't know if that answers your question.
It does as far as the plague goes. I mean, it's basically the flea of the rat, but if these people get sick with other diseases, they could spread the other disease, maybe like you say, TB, not necessarily the plague. I think you got to get bit by the flea, and that was it. And also, they're talking Clark County now about West Nile virus, that the swimming pools, they got dirty pools, and that the mosquitoes are hatching out. So it's like we got to worry about every kind of pest known to man and beast.
No, West Nile is definitely a summertime illness. It is carried in the mosquitoes are the vector, and birds help to transmit that. But it is a summertime illness. Obviously, mosquitoes don't breed well. I don't think we have. There's a few areas probably up by Ash, and I don't know that they breed, but it's only one particular type of mosquito that really carries the West Nile, and I don't know that it's indigenous to this area, but it's more common down south. And so the vector starts in the spring. It peaks in the midsummer to late summer, and obviously, if that's an issue where you start, in the healthy person, it would be probably a pretty severe illness, but in the elderly and the immunocompromised, it's a deadly illness. And so that's who usually ends up dying from all types of illnesses, really the flu and certain bacterial infections, or the elderly immunocompromised patient. Hopefully they're not outside being bit by mosquitoes, but that could very well be the case. But it's not really something that we deal with here in the desert. We deal with it more down in the south, where you get the marshlands and the mosquitoes and the stagnant water.
Is it anything to do with horses getting bit by the mosquito and then the mosquito transferring it to a person? I thought it had something to do with horses.
Well, that's a really good question. I thought that it was a mosquito infected from birds, but maybe I need to research it and come up with that. I don't know that horses are really a vector for that, but I'll look it up. I mean, not something that we deal with up here that much, but I think we can research it, and I'll get back to you on that.
I want to bring in one legal question that Louis DeCanio and I have been discussing for some time. It's seatbelts. They give citations for seatbelts, but seatbelt has never been a primary. If you understand what a primary is, supposedly they cannot stop you because you don't have a seatbelt on. It's got to be some other reason.
Correct.
Then if you don't have a seatbelt on, then they can give you the seatbelt ticket. It's $75. Well, I saw one in court today, and I confronted Lisa Shamley, who's an excellent judge, by the way. She's only on the bench about 8 months now. She's excellent. And I said, is it a primary? she didn't know. Neither did any attorneys I asked. I said, are these cops just citing people for seatbelts, which is illegal? And as Louis had told me, he says the people are just paying the $75 so they don't have to see a judge, and it may not actually be something that they could prosecute. So this is something that, when I'm in court, I see this stuff. It outrages me that you know, it's like a money game. Doc, they're looking for every dollar they can get. You know, they raised the price of the tickets. It used to be like $120 for a parking ticket. It's $195 now.
Yep.
Go into your pocket, you know, and pay us.
Yep.
And it's getting more and more so. So Louis and I, we almost got in a little verbal confrontation because he says, look, they like it that way, Flagman. And he said, why are you so adamant as far as challenging it even with the judge? I said, because it's not right. If it's not a primary, they should leave us alone.
No.
As far as ticket and click it or ticket.
No, you're exactly right. And in fact, one of my medical assistants had that same thing. They were on a thing, and they cited her for some other condition which she didn't do. He made it up. The officer made it up and then gave her a ticket for the seatbelt.
Right. They had this program, click it or ticket.
Right.
And I think they were having like what they call, I call them roadblocks. They call them checkpoints or something like that to see if you got a seatbelt on or whatever, you know. But right now, Louis pulls it up every Friday. There's what they call citation reviews, and there's a half a dozen people that are being cited solely for not having their seatbelt.
Yep.
Something's got to be looked into because all it is a money grab, and Louis knows it, and I know it too. But I'm willing to fight it, but it's just very upsetting to me. You know?
Well, and hopefully Lisa, knows that too, and she's very. I agree with you with her in that respect, and that she knows that she's a people's judge, and some of the other judges who have gotten there that being ex-law enforcement or law enforcement judges. So Lisa is very pro person. In that respect, that if she thinks that you're being abused by the system, she's going to take your side. But anyway, I got to go to. We're going to go to break, and
all right, I'll call later. Maybe somebody else will call in.
Yeah,
but,
that sounds.
I'm glad you're there today, Doc.
Yeah, sounds good, Ray. Thank you.
All right, bye.
We'll be right back. Thank you.
Bees Embroidery is celebrating 25 years of providing quality service for all custom garment printing and embroidery needs for Southern Nevada. We use only the best names like Port Authority, Haynes, and Gildan. We're open Tuesday through Friday 9 to 5. For a honey of a job, call us for an appointment at 775-727-9444 or find us on the web at beesembroidery.net or email us at bsembroidery@yahoo.com.
Hi, I'm attorney Jonathan Nelson with J.K. Nelson Law. I wanted to thank everyone that voted for the Best of Pahrump Awards for voting us Best Attorney of the Year. We've been an active part of the Pahrump community for many years, and we always work hard to earn your trust. So if you find yourself in need of a lawyer, put your trust in J.K. Nelson Law and call us for a free consultation. We can be reached at 775-727-9900. Again, that's 775-727-9900.
People with disabilities need their space.
Sorry, I'll be quick.
A workplace within reach. And help only when it's asked for.
Here, let me.
I'm all set. Thank you. After all, everyone should receive the same respect and consideration. Brought to you by the United Spinal Association. Download our disability etiquette booklet at unitedspinal.org.
Boy, that looks expensive. Not my problem. Hi, George, Foreman, and family here. We got tired of getting sucker punched with expensive home system and appliance repair fees. For about $1 a day,
We have Choice Home Warranty.
They cover over 25 major systems and appliances, including heating, AC, plumbing, kitchen, and laundry.
and if they can't fix it, they'll replace it. Never pay for covered home repairs again.
Call 800-493-8274.
Okay, so we're back, and now we have a little bit wider screen, so that's good. But Ray brought up the interesting point prior to the break about the West Nile virus, and so it is in the same class of virus like dengue fever and yellow fever, and the birds are the main vector of the illness. And the Culex mosquito is the one that basically is the vector. And since it lives naturally in the birds, it kills some of them, but it naturally lives in the sparrow being probably the most common bird, and then the robins tend to be also the highest birds that have the highest amount of virus in them. So if you see a dead bird, please don't pick it up. If it was shot, that's a different story, but if it just dies, the virus can actually kill the bird. So don't pick up dead birds, and if your dog has it, I don't think dogs carry it, but this is just one of those things where you have to have a vector to transmit that virus. HIV was transmitted from monkey bites. It lived in the monkeys, and it bit the natives, who then became infected with HIV. I think we have Louis. Are you on the phone?
Phone, Doc. Yeah, that's me.
How you doing, buddy?
I'm doing fine. Listen, I got a blood pressure question. Now, being that we're all different, how can there be numbers that they say this is normal for this and this is high and that's low? We're all different. The one question I really got is, how can a person know without, actually taking their blood pressure? Is there some way we can feel that our blood pressure is high or low, like in our body, the way our body reacts? Because I know we're all different. We can't all have the same blood pressure,
Yeah, blood pressure.
So is there some way, can I, say, well, gee, I feel like this. Maybe my blood pressure is low today, or I feel like this. Maybe my blood pressure is high today. That's my question.
Okay, so you're right about nobody's different, and blood pressure is different from every time you take it. You could take it 1 minute and take it a minute later, it'll be totally different. What I tend to think of is trends in blood pressure. What are the numbers? And I always evaluate blood pressure in the elderly people, anybody over the age of, let's say, 50, by subtracting the top number from the bottom number, and that's what we call a pulse pressure. And if you'll find that even though the top number may go up, so will the bottom number. So pulse pressure remains relatively constant on that. Now, that's just to evaluate blood pressure. So for that argument, 140 over 100 is the same as 130 over 90, which is the same as 120 over 80. Those are all the same pulse pressures. If you subtract the top from the bottom, they all equal 40. So that being said, when do I worry about it? If you're an elderly adult and your pulse pressure is above 60 to 70, then I tend to think that you're suffering from a different form of blood pressure. But in order for the body to feel it, it has to be a pretty drastic change. So if your blood pressure is rocking and rolling at about 130 over 80 most of the time, and then all of a sudden it creeps up to 150, 160, you may feel that as maybe a throbbing in your head. You may have some nasal congestion. You may feel like muscle tension. But then you don't know whether it's a horse or the cart, because our blood pressure is supposed to go up when we get upset. It's supposed to go up after we eat. It's supposed to go up at different times, and it's supposed to go down at different times when we rest. So most people feel low blood pressure. That's what most people feel. They feel tired, weak, withdrawn, drawn out. So in that case, I would definitely check your blood pressure to see if it's low, if you feel those things. And you could be dehydrated. You could have other issues that might be causing those problems, and that would be another issue there. So those home readings, those home blood pressure cuffs that fit on the wrist, no, they're probably decent to check a trend. I would suggest you bring it into your healthcare provider's office and run it against the gold standard, which is when they do the brachial pulse. When they put the cuff on you, that's kind of the gold standard, and then see how far off it is. And if it's not too far off, you set that trend and you just watch it and you continue to work with it.
Well, I don't want to use the word deadly, but how serious is high blood pressure? Because I'll tell you the truth, my blood pressure fluctuates, and sometimes When I'm upset, it does go high. But then again, sometimes, when I relax and I take it easy, it does come down.
Right.
So when it does go high, how, serious is that?
Well, if it goes high and then it comes back down, it's not that serious, okay? So we got to understand why it went high, and maybe, like you say, to relax and avoid that situation. To get an argument, it's supposed to go high. So what are the effects of maintained high blood pressure? Let's suppose, for the sake of argument, you're running blood pressure 160 over 100, 165 over 100. What is it going to do? Well, the blood vessels generally tighten in response to that blood pressure. So it almost becomes a predisposing, kind of like it almost makes sure that it's very difficult to untighten the blood pressure. The blood vessels are tight. They respond to that. They cut off circulation to vital organs. Your kidneys start to see decrease in blood flow, so those cells die off a lot quicker. Your heart increases its muscle thickness in response to blood pressure. So we call it left ventricular hypertrophy, where the left ventricle should be maybe about that big, and then it can expand to that big. And that's dangerous because the left side of the heart is the main pump function, and it feeds from the outside in. You would think that the heart would have this thing where it's full of blood and it would get fed. Absolutely not. The blood inside the heart doesn't feed the heart until it leaves the heart and goes through the coronary arteries, and that's how you feed the heart. And the only time it's fed is in the resting phase of the heart, meaning when the heart beats, it contracts really tight, no blood gets in to feed it. It opens up, and then it gets fed. So the thicker that muscle, the inside of the heart starts to die, and then you get congestive heart failure as a result of left ventricular hypertrophy. Not to mention causing atherosclerosis, right? The higher the pulse pressure, the difference starts to rip off cells in our arteries, then cholesterol builds in there. So then we start getting atherosclerosis as a result of that. And so, it can go on and cut off circulation to your eyes. It affects every part of your body that needs blood.
Which number is more important? Is the top number or the bottom number? I know they're both important, but which one is more serious if it goes too high?
Well, when you're young in your 20s, then the bottom number is important because it speaks loudly to the tone of the vessel. So if you're in your 20s and 30s and you're over 80 or 90 on that number, then that is also a concern. But once you creep up into your 50s, it's the top number that becomes important. You'll start to see the numbers start to diverge as you get older, and that's because our blood vessels get stiffer as we get older through various changes. So I'm going to try and explain this to you. I usually do it with a diagram and see if this doesn't make sense to you. You have a 4-inch pipe, right? It could be PVC, steel, whatever you want to do. And you're going to take a gallon of water, and you're going to pour that gallon of water in that 4-inch pipe, and it goes really fast, right? It just goes right through, no problem. Now you're going to take a 2-inch pipe, and you're going to put the same gallon of water through at the same time, meaning that gallon of water, let's say it went through in 10 seconds over a time. Now you're going to try and fit that same gallon of water in a 2-inch pipe. What is the formula for that? Well, I can't diagram it for you, but let me just tell you it's a logarithmic. It's 1 over the diameter to the 3rd power. So we decrease the diameter by a half. I have to have 8 times the velocity to get the same gallon of water because I decreased the diameter by a half. So if I have to push 8 times the velocity, what's the pressure going to do? It's going to go through the roof, right? Because you can't have increase in velocity without increasing pressure. And so that speaks to why, as we get older, our blood pressure tends to top number goes up and the bottom number goes down. And that's what's dangerous as we get older. So both numbers are important. When you get older, the top one tends to be the most important.
Okay, one last question, then I'll go. What is a danger? The top number, where is it dangerous at what point? Because sometimes mine will go pretty high, but it'll come down. What is a dangerous number at the top?
Right, and they recently reset those blood pressure parameters, and so let me explain that. So if you're in your 30s and 40s, I would say 140 would be the top number you would want, okay? 135, but once you start creeping into your 40s and your 50s, then 150 tends to be a high water mark. And when you're in your 50s to 60s, 160 tends to be the high water mark. Why? Because we want perfusion pressure. So as you get older, I tolerate higher blood pressure because we don't want you to have low blood pressure where you'll get lightheaded, dizzy, maybe have a confused moment and you'll fall, hit your head, break a hip, break a leg, break an arm. And those could be life-ending events, Louis. So we tolerate higher blood pressure as we get older. So when you're in your 20s, it's got to be, at 120, under 120. When you're in your 30s, it could go up to 130. Every decade probably determines the number, right? 50s, 150, 60, 160. I'd never want it to go above 160, no matter how old you are.
Okay, well, thanks a lot, Doctor. You answered a lot of my questions. Thanks a lot. I appreciate it.
Yeah, Louis, thanks for the call, and it's a real complex subject, but I think that you could use your decade of life to say, if you're in your 30s, I wouldn't want your blood pressure to be over 135. If you're in your 40s, we can tolerate, that 140 range. When you get into your 50s, we can tolerate that 140 range, 145 range. When you're in your 60s, I don't want it to go above 160, and the bottom number is always going to decrease as we get older. So with that excellent question and discussion, we're going to head to break, and we'll be right back. Thank you.
Hey, you.
Me?
Yes, you. Do you want the fastest internet in Pahrump?
Yes.
Valley Communications has the fastest internet for streaming video.
But can I binge watch my favorite programs?
Yes, of course. It's perfect for binge watching. And you can stream as much as you want. No overages, no data limits, and no buffering with Valley Communications internet.
I'll sign up today. But how?
Visit valleycom.com or call 775-727-5312. Don't wait. Get the fastest internet in Pahrump and binge away.
My part-time service in the Army National Guard allows me to keep my community and those I care about safe from threats. Learn more about how you too can live and serve part-time close to home by visiting nationalguard.com.
Everyone knows that landscaping in the desert can be a challenge. Land Art Landscaping is a licensed landscape contracting company that can design and install your own beautiful desert or even tropical oasis right here in Pahrump. Also, weeds can overcome your lot in no time. Land Art Landscaping can clean up the weeds and put you on a monthly service program to keep your yard maintained. Commercial and residential, call Land Art 727-8512. That's Land Art at 727-8512.
What's my passion? The sound of the ukulele, the softness. It goes right to your heart.
Stay engaged and keep doing what you love. Hear well, stay vital. Check your hearing wellness every year.
Well, everything's changed, I guess. I don't know. Anyway, we're back. So had a visitor on the break, so but that's nice. Anyway, 727-8750. Great discussion previously on blood pressure. So for all of you people out there, let's talk a little bit about blood pressure pills because I think it leads nicely into that discussion. So in general, I think if you find yourself with a high pulse pressure, the obvious answer is a diuretic, right? Because your volume is overloaded. So you want to reduce your volume because you've got this increased pulse pressure. So diuretics make up a very good component of blood pressure. There are a few racial issues about blood pressure. No, I'm not a racist, since that seems to be a common word today. But generally, the darker skinned people tend to do better with calcium channel blockers and diuretics, and the lighter skinned people tend to do better with ACE inhibitors and AR2 blockers. Beta blockers are one of these things that control your heart rate, and they control the strength of the heart contraction, but I would not want to use a beta blocker in someone who has a lung condition because our lungs have what they call beta receptors in there. They're called beta agonists. So a lot of people will take a puffer or inhaler, and that opens up your lungway. That's called a beta agonist, means it accentuates the beta receptors. So what's the logic in giving someone with asthma or COPD a beta blocker? Doesn't make sense, and it shouldn't, because you shouldn't be on one except if you're running out of option. If you take a beta blocker when you have asthma, or you take a beta blocker when you have COPD, you could be making your breathing worse. Now, the newer beta blockers are more selective for the heart and not the lungs, but there's always some bleed over from one of those others. So if you're a viewer out there, some people miss it. I mean, it does happen. I mean, they get doctors, this is the problem, one of the problems with medicine today. You go to the hospital and one of the doctors in the hospital decides to put you on medications but doesn't really know the entire history, and they change everything, and then you got to go back to your primary care doctor who has to reevaluate all those things. So, and a lot of times you find patients taking two of the same prescriptions, they're taking two like medications. So one of the things that Medicare looks at, and is very important, is that when you go to the hospital, having yourself seen by a doctor so that you can have what they call med reconciliation after hospitalization. It's a very important issue. Doctors tend to be really pin happy with the prescriptions, and they always want to, poo-poo somebody else's prescription. You need to be on this, because let's face it, I mean, people have been trained to go to the doctors and get prescriptions. I mean, they get kind of feel like if I didn't get a prescription when I went to the doctor, then he didn't treat me. Or you didn't get an order for the test, he didn't treat me. Those are some, I guess, stigmata that are associated with current medicine, and over time they're changing. I know they're changing with antibiotics, mainly because there aren't any new antibiotics being produced, and that's big pharma, right? They only want to produce prescriptions that you're going to take forever, and then they cost an arm and a leg. So that's how big pharmacy has doing that. So if you get a new antibiotic out, it's going to cost you $6,000 for a 2-week course, because that's what they think they can make off of you if they can give you a prescription to take for the rest of your life every year. It's kind of a screwy system, and I hope that one day they'll fix it, but I'm not going to hold my breath. So anyway, the cleanest drug that I use is an AR2 blocker. I know we saw a lot about the losartan recall, and I think Benicar and a few of those AR2 blockers. It's only because they put an inert ingredient that might be a carcinogen, just like, so I think it's long gone. All the bad pills have been removed from the market, and now when you get the prescription, it's not the actual drug, it was what they were binding it with, and that's the difference between a lot of generic houses, that they can say that it is chemically equivalent, but they can't say it's absolutely medically equivalent. So if your insurance plan allows you to stick with brand name, it's always a cleaner product. You know it's been proven to do this over this time. They had to get it approved from the FDA, but getting brand name products in today's market is usually pretty expensive. So if you have a good policy, some people have a really good insurance policy that covers just about every prescription with no questions asked, get brand name if you can. And if you can't, then buyer beware, basically the way you got to look at it. Blood pressure pills, when you take them, they work effectively, but they take usually a lead-in period of about 2 to 3 weeks, and when you discontinue them, they basically will also linger their effects for about a week, maybe 2 weeks, but then they'll slowly start to taper off. So a lot of people will take their blood pressure pills and they're like, well, my blood pressure is good, so I guess I can just stop. Well, that's the wrong thing to do. Your blood pressure is good because you're on the medications. And just because you don't have refills doesn't mean you don't need to continue the medication. Again, we talked about the ugly side effects of long-standing high blood pressure: kidney failure, stroke, bleeds in your eyes, heart attacks, congestive heart failure. Maybe it affects your intestinal tract and cuts off circulation, and you get, a bowel disease or something along that nature. You lose circulation to your lower extremities. Blood pressure is a serious issue. It's a very serious issue. They got blood pressure cuffs all over. You go to Walmart, you go to all those different stores, they have them. Ringing in your ears may be a sign of high blood pressure, but you got to evaluate when you're getting it. And the reason is because the internal carotid artery runs right past the inner ear. So the humming sound that you hear in a quiet room is actually blood running by and running through your ear. And so usually you don't hear it a lot because there's outside noises going on, but in a quiet room, if you hear that, that's really what it is. It's the sound of blood. And it's kind of dangerous if you don't hear it because maybe your heart might have stopped. But hopefully that's not the case. But anyway, that being said, check your blood pressure periodically. It is a good time. We do it in the office on every patient. It's just one of those things that you want to do. And if you're on blood pressure pills, making sure, if you're on a diuretic, you're checking those electrolytes, making sure that your potassium and magnesium are not being depleted. If you're on a calcium channel blocker, make sure that you're not developing too much edema in your lower extremities. We use a lot of combinations. The rule of blood pressure tended to be one pill for every 10 millimeters of mercury over 130, and as my practice has held up, that tends to be pretty reasonable. I mean, if your blood pressure is 150, 160 over 100, that's a pretty wide pulse pressure. It's probably going to take me 3 or 4 medications to get that under control. And again, if you're checking your blood pressure at home, don't do it after you eat. Wait at least an hour. Don't do it after you smoke, because nicotine is a very potent vasoconstrictor. Okay? Take your blood pressure pills if you're on them. Wait at least a couple of hours before you check your blood pressure. Always be sure to make sure that if you have nighttime medications, you never forget, because they have a circadian rhythm bump in your blood pressure early in the morning. In fact, they did a study. They showed that if you were on like an ACE inhibitor, like lisinopril or enalapril or one of those drugs, that you actually did better if you took it at night before bed, because it reduced the events of heart attacks. And so AR2 blockers and lisinopril, those drugs are very good for protecting your blood vessel lining. They have some additional effects. So there are good prescriptions out there, and then there are some that are not so good. And beta blockers are one of those that we tend to stay away from, if at all possible, but sometimes you have to put those in there. There was a recent study about diabetes and beta blockers, and they said that if you're a diabetic and you didn't have to be on a beta blocker, that you shouldn't be on one. There was a increased risk of all-cause mortality. So what does that mean? It means you can die from a lot of different things. It doesn't matter. It wasn't just diabetes. It just wasn't stroke. It just wasn't heart attack. It's all other forms of death. I don't know. I mean, there may be a study next week that says that that's not the case, but that's the last that I interpreted on it. So if you're a diabetic on a beta blocker without having a heart attack or congestive failure, you might want to reevaluate that beta blocker and look at it. Not only that, beta blockers block the sympathetic nervous system, so you don't feel low blood pressure or low blood sugars so much when you're on a beta blocker. And that could be why there was a risk in all-cause mortality, meaning that if your blood pressure is starting to go low and you don't feel the symptoms, you don't know to get something to eat. You stand up, pass out, hit your head, break a leg, break a hip. Those could be life-ending events. So maybe that was the issue. I didn't read the article and thing. It was just read the blurb on it. But that being said, beta blockers are dangerous for diabetics in that respect, and asthmatics and COPDers. I can't tell you how many people that have COPD that come in there, they're on a hard beta blocker, and you take them off, and their pulmonary function test really does improve. So, or someone's having to use their inhaler. And if we have enough time before the next break, if not a call-in, I'll maybe dwell a little bit on those rescue inhalers. They're very dangerous to use all the time, and they should be used as a thermometer to let you know that if you're starting to use that inhaler more, that you might be having a problem, and that problem could possibly be deadly. So with that, we're going to take a break, and we will be back for the last short session. Thank you.
Now is the time. Get off your seat and into the beat of fitness for just $10. We offer everything you need at our hometown gym, and most plans are just $10 a month. Plus, there are no long-term commitments required. We have tons of options: yoga, high and low impact cardio classes, circuit training, and new innovative classes to keep you motivated. With 15,000 square feet of fitness, we are the largest full-service gym in Pahrump. Get started today. Come and see us at Fitness 410.
We've been fighting the war on drugs for a long time. We answer the phone 24/7, 365 days a year. On a busy night, we answer hundreds of calls. This war on drugs needs our intervention.
Since 2014, Addiction Hope and Helpline has helped people struggling with drugs and alcohol.
When the phone rings, we help people when they need it the most. When we get a caller into treatment, it feels right. It feels good. It's a blessing.
If you're struggling, drinking, using, and need to get clean, don't suffer alone in silence. Call Addiction Hope and Helpline.
Our people understand, and many are also in recovery. Call for support and strength. You can call for someone who can't or isn't willing. It's an act of love. Together we can help you beat this thing and erase addiction from your vocabulary once and for all.
Call 800-773-0131, 800-773-0131.
I just got a new air conditioner. Top of the line.
I bet mine's better. It's so efficient and quiet, I hardly know it's running.
I've got you both trumped. I've got a Linux.
So do I.
John Air carries Lennox products to meet any budget. Don't gamble with your energy dollars. Call John Air.
Lennox. Innovation never felt so good.
So we were talking a little bit before the break about the beta agonists or the inhalers. So for those people out there that use them, there is a thing called the rules of two, and it tends to govern the use of these inhalers. And so what that means is if you have more than two, remember asthma per se is an inflammatory disease, and these beta agonists are not anti-inflammatories. So if you're using a rescue inhaler, and that's the main term to get by with breathing, sooner or later you're going to get used to that inhaler and it's not going to work and you can die from asthma. So that's why it's so important for particularly asthmatics to keep track of how often they're using their inhaler. So if you're using it more than, I think, 2 canisters in a month, maybe, and 2 trips to the emergency room in a year, and 2 uses in a week, you may be having trouble and you may be setting yourself up. So Ray called back. Ray.
Yeah, Doc, I was going to ask a question earlier, but I knew Louis wanted to call in, and I like when you just, elaborate like you did on the blood pressure pills and everything. I understood most of it, and I think people would be able to hook into it. Sometimes you throw those terms out there that kind of confuse me a little bit, but then I ain't no doctor, and you are. So there
I know. I got to be careful of that.
Yeah. I have a friend who had a problem as far as blood in the urine, and he just went to the hospital. I told him, I said, go check it out. He said, I don't want to leave my dogs. Something may happen to dogs. I said, look, you got to go check it out. He was there for 4 hours. They gave him antibiotics, and they told him it was something to do with the bladder, that he was bleeding when he's urinating. And what is it if you're peeing blood? What is it? Is it the bladder, or is it something more serious? Is it just a bladder infection? What's going on? It's never happened to me, but it would scare the hell out of me, Doc, if I would have...
Oh, yeah. And here's the other thing, Ray. It doesn't take but maybe a millimeter of blood to turn the toilet bowl red. It takes very little blood to change the color of the toilet bowl. So that's a very interesting thing. And so there's a lot of causes for hematuria. Most of them are benign. Most of them you never find any cause for, but the obvious risk, especially in today's thing, and especially in the elderly, is bladder cancer. Okay, and so people who smoke have a really high risk for bladder cancer, and it's a transitional cell cancer is the most likely cause. So then there's renal cell carcinoma or kidney cancer. So anything up in the kidney can bleed, travel down the ureter, and you'll see it in your bloodstream. So if someone comes in with hematuria, one of the first things I do is I get an ultrasound of their kidneys just to make sure they don't have renal cell carcinoma. And then I do a urine for cytology, which means I collect the urine and they spin it down and they look for cancer cells. And then if they don't have that, if it burns when you urinate, and hematuria, that is a urinary tract infection. Males should not get urinary tract infection. Plain and simple. You're allowed to get one in your life, and the second one, it means you need a urologic workup, okay? The reason is because the urethra is about 4 to 6 inches long, depending on the male organ size, right? I mean, it varies in length. But your women's urethra is less than an inch. And it's really easy for bacteria to come up from the perineal area into the vaginal area and get infected in the women. So urine flow is the most important thing for females to keep them from getting infection. For males, you just shouldn't get an infection. And if you do, there's some other reason by it, and that should be taken into account. So the emergency room...
STDs on that or what?
Huh?
Are you talking STDs as far as infections for men?
Well, if you get chlamydia, gonorrhea, syphilis, or one of those STDs, you won't necessarily have blood in your urine. It will just hurt like the dickens to urinate. So that's a different story altogether, as opposed to having just bleeding is a little bit of discomfort, but there's more blood than there is pain. That's a different story.
I see. One other question I want to ask, and I asked it about a year ago on your show. Thorathrast. Did you ever research that, Thorathrast?
What is it?
It's called Thorathrast. It was something they did to enhance X-rays back in the 50s.
Oh.
My brother Rich had a broken arm when he was like 10 years old, and they X-rayed it, and I believe they used Thorathrast, and he died of liver cancer at 52. So, and they said once you got the injection, there was no stopping it. And then I had a sister-in-law who died at 55, and I believe the same thing happened. And I don't know if, what's the situation, if it was just something like they approved it and then took it off of the market or whatever.
They probably injected a radioactive substance into it to enhance the radioactivity on certain blood vessels or something like that. I mean, they did. I mean, we know that all the radiologists that were developing X-ray never became old radiologists. They all died of some type of cancer from being exposed to X-ray before they really understood what they were dealing with. So that's unfortunate. Just like thalidomide back in the 60s, right? They were giving it to females as a tranquilizer, not knowing that it was going to cause all the limb deformities that it did.
I think that's still being used for different treatments, isn't it?
What's that?
I think it's still being used, not on women, but for different treatments.
Right, thalidomide is being used, I think, in some cancer treatments and things of that nature, if I remember correctly, but I'd have to research it. But, yeah, I mean, it's pretty potent stuff, and it causes a lot of problems. So, it's interesting that you say that, because there's a lot of drugs that don't do certain things, but then they reinvent them. One of them was sulfa, the first antibiotic that used to be handed out all the time. All of a sudden nobody was using it. The bacteria forgot about it, and then they started using it in methicillin-resistant staph infection. So it became a primary antibiotic again. Pretty interesting how that all works out.
Well, I got one bad thing to report. Itchy ate my cat just brought in a baby rabbit that she had whacked, and I'm going to give her a verbal thrashing when we're done here. It upsets me, you know. With all the mice in the world, she's got to go after baby rabbits, you know. And she don't listen to me. I tell her, yeah, you can't be doing this, you know. She does whatever she wants, you know. I got her for 5.5 years now, so I guess I can't retrain her, you know, but it's just how it is.
She killed all the mice, and now she's got to hunt something, so then there's a rabbit, right?
That's right.
And then
you have a good show tonight, and I hope you're on every week. I really enjoy it, and I'll tell more and more people about it.
Hey, while you're on the phone, is Chuck okay? I haven't heard from Chuck in a while.
I think he's doing all right, but he's got, like you are aware of, the family problem, you know. You know, with his granddaughter.
Yep.
It's the last I heard. You know, maybe he'll call in one day.
Well, if you see him, you tell him hello for me. I haven't seen him in the office in a while, so.
I'll do that. And I want to finish with, I accept Jesus Christ as my Lord and Savior. Keep the faith and power to the people. Ray the Flagman, over and out. Have a good night, Doc.
Yeah, thank you, Ray, for calling. So, yeah, lots of good topics tonight. But if you're out there, do get your blood pressure checked. Do make sure that happens. It's a very, very important thing. And make sure you review your medications after you've gotten out of the hospital for any particular reason. If someone gives you a prescription while you're in the hospital, make sure you review it with your primary care doctor. It's quintessential to make sure you're not duplicating your medications and the doctors know what you're taking. We have our patients bring their prescriptions in all the time for the most part so that we have a good idea of what they're doing and we're trying to eliminate medications whenever possible. I would much rather you be on a lot lower ones. And I had this, briefly, I only got a little bit of time left, but I had a patient come in today, it was the last patient of the evening, and she was on a blood thinner and it was prescribed by a cardiologist, and whatever condition she was on, it tended to dissipate, but she was still taking the blood thinner. So it's always good to go over all your medications. You should do that on a yearly basis with your doctor and make sure. I have lots of patients come in and say, do I need to take all these prescriptions? And I go down the list and I look at them, and we do individual. So if you haven't had that done in a while, please make sure you do that. And with that thought, we're going to close. Thank you for coming in tonight. See you next week. Thank you.
Hey, Ace Country listeners, you can now catch Ace Country Radio on KPVM-TV, channel 46.7. Catch me, Fitz, F-I-T with a Z, in my radio show on the TV. Send your livestock, your pigs, your cows, your donkeys, whatever it is, your favorite pet videos or photo to mobileburn@gmail.com. That's mobileburn@gmail.com. We're going to upload the videos and play them on the TV. Wait. Yes, I said on TV. That's right, you and your animals. Getting all famous and stuff. Send Ace Country those funny videos of the creature around the farm or the house. You could win a date with me, Fitz, on the air. Actually, you could actually win a pair of concert tickets for the best entry because I'm a married man. Happily married man. I got a bunch of babies and I got a bunch of animals. So I might be sending my videos too. It's an all call, y'all. Get out the camera, shoot some videos, or take a photo of those creatures and those animals. There is not a time limit.
Hello, this is Don Trudeau, inviting you to our all-new RV sales lot. You can now buy a new or pre-owned car, truck, van, SUV, or RV from your original hometown dealer, Cited Trudeau. Now when you're shopping for an RV, you will get the same competitive pricing and hometown-friendly service you have come to expect from Cited Trudeau over the past 18 years. And just like with our cars, we refuse to be undersold. When you buy in Nye County as opposed to Clark County, you get Nye's lower sales tax rate, and the sales tax dollars stay in Nye County to benefit our roads, schools, and emergency services. We will take your current RV, truck, boat, motorcycle as trade. Not looking for a car or RV, but have one to sell? As long as it's in sound mechanical condition, we will pay you on the spot for it or consign it. Come see us in the center of town, 1031 Highway 160, or browse our inventory online, CitedTrudeau.com. We want only to be the best.
Hey, you.
Me?
Yes, you. Do you want the fastest internet in Pahrump?
Yes.
Valley Communications has the fastest internet for streaming video.
But can I binge watch my favorite programs?
Yes, of course, it's perfect for binge watching, and you can stream as much as you want. No overages, no data limits, and no buffering with Valley Communications internet.
I'll sign up today, but how?
Visit valleycom.com or call 775-727-5312. Don't wait. Get the fastest internet in Pahrump and binge away.
My part-time service in the Army National Guard allows me to keep my community and those I care about safe from threats. Learn more about how you too can live and serve part-time close to home by visiting nationalguard.com.
What's my passion? The sound of the ukulele, the softness. It goes right to your heart.
Stay engaged and keep doing what you love. Hear well, stay vital. Check your hearing wellness every year.
Hi, I'm Attorney Jonathan Nelson with J.K. Nelson Law. I wanted to thank everyone that voted for the Best of Pahrump Awards for voting us Best Attorney of the Year. We've been an active part of the Pahrump community for many years, and we always work hard to earn your trust. So if you find yourself in need of a lawyer, put your trust in J.K. Nelson Law and call us for a free consultation. We can be reached at 775-727-9900. Again, that's 775-727-9900.